To image the maxillary canine tooth using CR or film systems, generally you want to pick a size of plate that's big enough to image the entire crown and the root of the tooth. So a lot of the time I'm using size 4 plates. As far as placement, you're going to place it in so it's nice and flat in the mouth, so both canine teeth are generally biting on it. A little paper towel can securely keep it in place. As far as the cone, I want to look at the angle meter and I want to ensure it's at a 30 degree tilt before I find my bisecting angle, and I can see that it is. The canine tooth is a tooth at the front of the mouth, so I am going to stand at the side of the patient to best determine the angle that the tooth enters the skull. Remember, with canine teeth in dogs, you're going to ignore the crown and you're going to remember that the tooth does curve quite distally. So here is the angle of my tooth. I'm going to use the side edge of my film, so halfway in between is about here. And then what I'm going to do is I'm going to position my cone so that it's directed right at my bisecting angle. So I can see when I move my stick up that I'm directed nicely at my bisecting angle. Last thing to do is to look from a couple different angles to make sure that you're centered on the canine tooth. I want to have it back 4 to 6 inches to ensure that I have a wide area of x-rays. After it leaves here, it fans out to be able to image that entire canine tooth. And also look from the front to see where the center of that cone is. And that's a way that we would image the maxillary canine tooth using a CR or regular type film.